Now let's take a step-by-step look at how to apply a cervical collar. Take BSI precautions. Approach the patient from his or her front. As you walk toward the patient, introduce yourself and instruct him not to move. Maintain manual cervical stabilization. Explain the procedure to the patient and gain consent to treat. Check pulses, motor function, and sensation, PMS, in each extremity. To do this, palpate radial and pedal pulses. Assess grip strength as well as flexion and extension of the feet. Touch the patient's extremities to determine perceived sensation. Determine the proper size of the cervical collar by measuring the distance between the patient's trapezius muscle and angle of his jaw. Use your finger width as a guide. Correlate this distance to the distance on the cervical collar between the bottom of the rigid plastic and the sizing post. Do not include the soft foam in your finger width measurement of the collar. The foam provides no support and will compress when positioned around the patient's neck. Angle the collar for proper placement. It should rest on the patient's clavicles and mandible. For seated patients, slide the collar up the sternum until it is in position under the jaw. Then wrap the collar around the back of the neck, securing it in place. For supine patients, slide the back of the collar in place under the head and neck, then wrap the front of the collar around the neck until it sits in place. Check for proper fit. The collar should not hyperextend the neck or fit so snugly that it constricts the airway or impedes breathing. Maintain manual cervical stabilization until the patient is secured to a spine board. Reassess the patient's pulses, motor function, and sensation, PMS, in all 4 extremities, noting any changes from your initial assessment.